is the Emergency Medical Minute.
So as the one of the state's drug guys, I get a lot of questions. And one that a lot of emergency department doctors ask me is, are you using IV Tylenol or just PO Tylenol for pain? And definitely in Europe, IV Tylenol is used very broadly. If you're on an ambulance and you have severe pain, usually they'll start you off with IV Tylenol. Here we don't use as much IV Tylenol. We use mostly PO Tylenol, mostly because of cost. I was just talking with Rachel, our pharmacist, and she says that a dose of IV Tylenol costs around $40 for the hospital, whereas PO Tylenol costs around, less than $1, probably around 30, 40 cents, something pretty damn cheap. Okay. So the question, though, that I keep on getting asked is it more efficacious? Does IV Tylenol work better than PO Tylenol for control of severe pain? And what do you guys think the answer is? I hear some yeses, I hear some nos, and here is the one ED study that looked into it. It was an ED study done in Australia. 86 Australians had really bad pain, and they came in and they're randomized to a double dummy control blinded study where each of them got a pill and an IV, and they didn't know which the Tylenol was coming from, if it was in the IV or in the pill. They ran this out, and guess what? After 86 people, the pain control was equivalent between PO and IV. So if you read the headline, you think, oh, great, that answers this question. And then you actually read how the study was done. So it was used concomitantly with narcotic pain medications. 86% of the patients got a narcotic first, and they gave them some Tylenol on top of it. So if you're designing a study to test the efficacy of a drug, would you design it that way? The answer is no, because there's way too many confounders, especially since people are suddenly knocked out, right? So all in all, here's what I tell people. We don't have any good emergency department studies that answer this question. It seems in other studies that PO Tylenol is slower acting, so it's slower in onset, but equally as efficacious as IV Tylenol, and that's why you're not using IV Tylenol in the emergency department yet. So, okay, PO versus IV.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.